Hi, my name's Ollie. I'm one of the advanced clinical practitioners here in cardiology at Bart's Heart Centre. Primarily look after patients who've come through our emergency heart attack service.
I'm Dr. Das. I'm a cardiologist at the Bart's Heart Centre and I'm the CEO of Ortus-iHealth.
My name's Dan Jones. I'm a consultant interventional cardiologist here at Bart's and a lecturer at Queen Mary University of London. I mean, we're the busiest, or the biggest heart attack centre in London and one of the biggest in the UK and in Europe, and we do a lot of primary PCI. And we deliver this service very quickly and efficiently. The problem comes with the aftercare. We've got a lot of patient, a lot of throughput, and the follow-up tended to be pretty erratic. There was no consistent approach. They were seen by different consultants in different locations, and sometimes they weren't seen at all. So we had a fairly big problem that needed to be fixed and ideally standardised.
We know that medicine is getting ever more complicated. Patients are living longer and outpatients service are becoming even more stretched, and the importance of follow-up and more regular review for patients is ever more important.
Sometimes we weren't able to up-titrate and increase those prognostic medications as much as we'd like to. So patients were potentially staying for a longer period on lower doses when we could have increased those if we'd been able to see them earlier.
Everyone should have the same quality and consistent follow-up, ideally a timely manner to enable the up-titration of medication and to monitor their symptoms and their recovery. A digital platform enables this as our catchment area is very wide. We serve 10 district hospitals. It's an area of 5 to 10 million people, and travelling to hospital can be inconvenient for a large number of them. So the ability to be able to contact patients at home or via a remote platform is appealing.
I initially started this thinking, how can we remotely follow up patients and enhance our outpatient service through the aid of digital technology? And that's what led me to create Outpatient.
As we've seen with COVID not being able to get patients into hospital, this has presented an ideal solution.
So the key elements to the platform that allowed this to happen was us to digitise that entire journey. So if patients would get their appointment via an SMS and then ask them to download the application or through the website, we'd then have the remote monitoring functionality where their patients can upload their blood pressures and heart rates, or even connect up to their Fitbit or Apple Health device, so we can remotely monitor that. And that allows us the ability to see what's going on and then actually act on that.
I find the blood pressure and the heart rate is great because I can get a picture of how they're doing on those medications.
We took an opportunity to get patient-reported outcome measures to each of our heart attack patients.
All the outcomes that we routinely record after primary PCI and AMI are very clinically based. They're MACE, they're all-cause mortality, is someone alive at 30 days, whereas this does give us the opportunity to look at different metrics that are actually probably more important to patients, their quality of life, their symptoms, their observations, their medication, things like that we can capture on a routine basis, and it's very easy to capture them into a database when they're via the app. So there is the potential for research.
I have found it useful, particularly the questionnaires. They get sent a series of questions to answer before coming to the clinic, and I can review that before they come in. Those questionnaires include a variety of things from physical symptoms to their mental health, their day-to-day living and activities, and how that has impacted on it. So that's been very beneficial.
We would get the ability to let the patient know remotely through the clinical letter function what to do with their medications.
It's far safer for me to up-titrate someone's Ramapril for 5 to 10 milligrams if they know their systolic blood pressure is 130/80 and that it has been persistently over readings that have been recorded over the last couple of weeks than I am just on a one-off reading that the patient's feeling fine. So I think I'm having the ability to up-titrate pills based upon a blood pressure and a heart rate to optimise the medication is ideal, and that's not something that currently is done.
And lastly, the video functionality allowed us to see them earlier, as we didn't have outpatient capacity at the time, but we created an office with a webcam, and that allowed us to see us where we'd normally see them after or 3 months or longer, we're now regularly seeing them within 8 weeks post-discharge.
So I think it's a fantastic tool to be able to enhance and change care and provide different options.
For an acute myocardial infarction pathway, it's perfect. All these patients have follow-ups, we've met them, we know all about them, we have all their information on discharge, their medication, we've examined them, we know what they're like, and this is a perfect forum to be able to speak to the patients, assess their symptoms, see how they still see their physical appearance, but obviously we can't examine them, but we've done that before they go home. We know what their test results look like from discharge, and with the ability to up-titrate medication if they have blood pressure readings they can load into the app is the same as we'd get in a clinic, and actually it's perfect for that sort of service.
It's been very beneficial for our patients.
From a quality improvement perspective, now in this current climate, so in the coronavirus or COVID pandemic, the virtual clinic has enabled us to rapidly discharge patients from hospital at much sooner and quicker time points than we had previously, which is a benefit to both the patients and to the hospital from a cost-effective and length of stay perspective from the patients. If we can safely get them home, and meaning they get less exposure to potential infection, it's a win-win for everybody.